Hi John, how are you today? Do you remember me? I'm Dr. Wilson. I'm your hand doctor. We performed some tests on your hand and we got some results back. It appears you have a very bad infection in your hand.
Really? You think there's a bad infection? Look, it's getting better. It's beautiful. Beautiful hand.
Okay, well if you actually take a look at your hand and compare it to the other one, the coloring, this is extremely infectious. And there's only one thing that we can do, and unfortunately that's to amputate your hand to prevent. I understand this is hard news for you, but it's necessary in order to prevent the infection from going up your arm and losing your whole arm. There's still options of prosthesis for your hand. You can still be able to function like a normal person.
I function like a normal person right now. My
Unfortunately,
hand,
this infection
fine.
will only get worse.
There's no way it can get worse. Like, my hand is like, I learned, I went to school, like, this joint over here, it was separated from the rest of my arm over here.
But unfortunately, the tissue is connected.
Well,
and it's a tissue infection. It's necrotic. Do you know what necrotic means?
Necrotic's necrotic. Crocodile, necrotic.
No, it eats away at the skin. And unfortunately, that's what's happening here. You're losing blood flow to your hand. So this surgery is necessary. I understand this is hard for you. I'll give you a few minutes and I'll come back, okay? Is that okay with you?
Sure, go up. I don't want to hurt you, so you can leave.
Okay. I'll be back in a few minutes.
Hi John, I'm Michaela. I'll be your nurse today. How are you feeling?
How am I feeling? I'm fine. I am perfectly fine.
Wait, you don't seem fine. Would you like to talk about it?
Like, you don't know what's going on? Or maybe you don't know what's going on. Professionals, these healthcare professionals, you guys are not professionals. You guys probably don't talk at all. See, I can't trust you guys. I cannot.
Well, I know that Dr. Wilson came in this morning and talked to you about different options in surgery for your hand.
Options for my hand? Do you really believe that losing my hand either way is an option? That's not an option. Not an option.
Okay, well, I know this must be hard for you, but in fact, losing your hand would probably be the most likely outcome, whether you forego your surgery or not.
Gus! I cannot lose my hand. I cannot. I need it for my job. I'm a construction worker. I do hands-on stuff. Without my hand, I cannot do hands-on stuff. Like, I'm sure that you may understand that, but I can't. Like,
I understand that you're upset right now.
Upset? You think this is upset? You haven't seen me upset. You see these flames coming from my head? That's how it shows how upset I am. Like, just can you go away? I don't want to talk to you. Go away before I hurt you, okay?
Okay,
before I hurt you.
I will give you your personal space. I can have someone come back and talk to you if you like in a little bit.
Let's go. I'll talk to anyone. Anyone except for you. Anyone except for you, okay?
Okay, I will give you your space.
This hospital sucks.
When patients like John experience very difficult news and exhibit anger and aggression, it can be also very difficult for the nurse to handle as well. Some important things to keep in mind when this occurs is to always give patients their personal space, provide them with options, always be honest, and always use a calm, clear tone of voice. This is important to provide for nurses' safety.
It's beautiful. Beautiful hand.
Right now you discuss options
Get away! Before I hurt you, I will chop you with this hand.
is to always keep the person.